The AF Screen International collaboration was something I started about 3.5 years ago with 4 or 5 friends to try and promote awareness of atrial fibrillation, to try and promote advocacy of screening for it as a way to prevent stroke, and to promote research and collaborative research around the globe. And I think the strengths of atrial fibrillation, or AF Screen as we call it, is that it's a global organisation. It has 160 members from 36 countries. It includes not just cardiologists and electrophysiologists, but general practitioners, geriatricians, and general physicians. It includes stroke neurologists. It includes nurses. It includes pharmacists and other healthcare professionals. And most importantly, it includes patient organisations like AFA, like afib.org, stopafib.org. And it includes epidemiologists and health economists. So we bring together a whole range of people from diverse groups to try and promote one goal. And I think that's our strength, that we're in it all for the same game. We tend to collaborate rather than compete. And I think we've already done something that's important. We've produced a white paper on screening, and we're about to produce a white paper, hopefully soon published, on screening post-stroke. But we'd like to prevent stroke. I think it's taught us one thing, that we can do it. It's likely to be cost effective, and it's probably likely to be effective in preventing stroke and death, if we can do it well. The great problem is that it's hard to do it at scale. So if you can only screen 5% of the population, it's just as cost effective as if you screen 75% of the population, but you will save many fewer strokes. So to save and prevent strokes, we have to screen a large proportion of the population. And when we find it, we have to do something about it. So if we find it and do nothing about it, we've done nothing. But if we find it in lots of people and we do something about it, then I think we can prevent stroke. And that's the message that we're trying to bring from AF Screen. But what we're also trying to bring is research. If we screen more intensively, we might find AF that has a lower risk of stroke. We're not sure whether we should be treating that, and only trials will tell us whether that's what we should be looking for. But as far as just taking your pulse in your doctor's office or checking an ECG once a year, that seems to be effective, and that's at least what we can do now.